This is adult assessment, so I'm going to gather my supplies. My supplies right here. Now I'm going to go on into the patient's room. Fatima.
Hello.
Hi, I'm Amanda. I'm going to be your nursing student for today. Can you please tell me your name and date of birth?
Roy Baker, 11/13/60.
Okay, are you allergic to anything?
No, I'm not.
Okay, I'm going to provide So I'm just here to perform a head-to-toe assessment on you. The reason why we are doing this is to help find any medical abnormalities that need further medical attention. So a head-to-toe assessment is basically where I have to look, listen, feel on all of your body parts to help detect like any medical abnormalities that you may have missed. Do you have any questions?
No questions.
Do you have any cultural or spiritual beliefs that I should be aware of?
None.
Okay, can you tell me about your relationships and how you've been feeling emotionally?
I have a good relationship and I feel good emotionally.
Okay, so now I'm going to grab a set of vital signs on you. I'm going to grab a blood pressure, a respiratory rate, a pulse, a temperature, oxygen saturation, and then the pain assessment. So I'm going to grab your blood pressure. Do you have any implant medical devices in here?
No, I don't.
And lower your arm. About 116/82. I'm just going to put this pulse oximeter on you. It measures your oxygen saturation and your pulse. Okay, I'm going to take a temperature. Goes on your forehead. 98.6. Respirations were 16, oxygen of 90%, and a pulse of 61. How would you rate your pain on a scale of 0 to 10, 0 being no pain, 10 being the most pain?
0.
0? Okay. So I'm just going to ask you some silly questions, but they do have a purpose.
Mhm.
So can you tell me who you are?
Roy Baker,
Can you tell me where you are?
at the hospital.
Can you tell me what time it is?
So around 1:30.
Can you tell me like what the situation that's going on? The event?
Assessment.
You're getting assessed?
Right.
Okay, so based on my interactions with him, I can say that he is conscious, alert, and oriented to person, place, time, event. He will only follow my commands by answering my questions appropriately. His mood is relaxed, and the effect is of relaxed body language, laying down, and his auditory acuity. He is able to hear me talking at a moderately pitched voice. So my general impression, he is sitting up, he's wearing clothes appropriate for the weather, he's not in immediate distress, he appears well groomed, and he doesn't have any foul odors coming from his body or his breath. So now I'm going to go ahead and start the assessment. So I'm looking at your head size, shape, and symmetry. So the head size is proportional to his body, say normal cephalic. The symmetry, his head is symmetrical. circular with no deformities. I'm going to palpate your head and take a closer look at the size, shape, and symmetry. No deformities present. His hair is not patchy, it's well distributed, and he doesn't have any infestations. So now I'm going to assess your sinuses. So I'm going to do frontal and maxillary sinuses. Were those tender?
Never know.
Okay, so non-tender and non-swollen sinuses. His overall appearance, he appears well groomed. He's not in distress. He's not tripoding or having any difficulty breathing. He is overall just in a relaxed state. So now I'm going to assess his eyes. So I'm going to assess your facial movement now. So can you smile real big? Can you frown real big? Can you stick out your tongue? So his facial face is symmetrical. He does not have any deficits with his facial movement, and he has full range of motion and control over his movements of his face. Okay, so now I am going to assess your eyes. Focus on this right here and then something right. So his pupils are equal, round, reactive to light and accommodations. You can go ahead and open your eyes still, please. His eyelids are not swollen. His conjunctival sac is pink, and his sclera is white. He doesn't have any nystagmus or strabismus present. I'm looking at his nose now. His nose is symmetrical, no lesions or skin breakdown. His skin is clean, dry, and intact, and the nose is not runny. So, do you have any problems with your eyes or your hearing or your head?
No.
Okay. So now I'm going to assess his ears. Okay, so can you turn that way, please? Thank you. So there's no lesions on his ears. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. I'm going to palpate for tenderness. Is that tender?
No.
Okay. So now I am going to assess drainage. There's no drainage present. I'm going to go ahead and go on to the other ear. So his skin is clean, dry, and intact. There's no lesions present, and the color is appropriate for his ethnicity. So now I am going to palpate for tenderness. Is that tender? Okay, now I'm going to put this in your ear to assess for drainage. There's no drainage. Do you have any problems with your hearing?
No. No.
Okay, so now I am going to look at your mouth. And he does not have any deficits with his facial movements. So his lips are pink and moist. Can you open that big? So his uvula is midline, his mouth is moisturized, there are no lesions present, the skin is intact. His dentition, he does not have any chipped teeth, and he's well groomed. The uvula is midline, and the skin in there is pink and moisturized. Yep, it's pink and moisturized. Do you wear any dentures?
No.
No? Okay. So now I am going to look at the neck. So his trachea is midline. There is no JVD present. I do not see any large lymph nodes, Gaudier, or masses. I'm now going to palpate. So I'll palpate your lymph nodes. Those are non-swollen. Are they tender?
No.
Okay, I'm going to have you look towards your right. Assess the carotid. Carotid is present, 2+, and no JVD is present. So now I'm going to have you look the other way. No JVD present. Carotid is 2+, and now his lymph nodes are non unswollen. He has no masses. Gaudier present. Okay. Have you had any problems with your throat?
No.
Okay. So now I'm going to assess your upper extremities.
Mhm.
So, your skin is clean, dry, and intact. No presence of lesions. The color is appropriate for his ethnicity. Now your skin is clean, dry, and intact, and the color is appropriate for ethnicity. His fingernails are not clubbed. These fingernails are not clubbed, and his knuckles are not swollen. Knuckles are not swollen on this hand either, and fingernails are not clubbed on that. So now I am going to assess circulation. So he is warm to the touch. He has bilateral equal radial pulses 2 plus. And now assess your motor skills. So squeeze my hands. So he has equal grip strength. Now can you go like that? He has full range of motion for fine motor skills. And now I'm going to assess your large motor skills. So you can go ahead and sit up. So I'll have you raise your hands up, down, and then around. Experiencing pain with that?
No.
So he has full range of motion with gross motor skills. So now I'm going to do a sensory assessment. So I'm going to close your eyes. I'm going to touch a finger. You can tell me what finger I'm touching.
Pointer fingers.
Okay, so now I'm going to palpate. Are you tender?
No.
Non-tender, non-swollen. I'm going to palpate again. Okay, are you tender?
No.
Non-tender, non-swollen, and his muscles are equal and symmetrical in size. So now I'm going to assess your capillary refill. Okay, capillary refill was less than 2 seconds. Okay, capillary refill was less than 2 seconds on all fingers on those upper extremities. Okay, now I'm going to assess his back. So, I'm looking at his skin integrity. His skin is clean, dry, and intact. His spine is within midline. There's no kyphosis. His skin is warm to the touch. And the color is appropriate for ethnicity. And now I'm going to palpate. Let me know if you're tender.
Okay.
Are you tender?
No, not.
Okay. No masses on palpation, no tenderness. Okay. So now I am going to have you lay down. So I am looking at your chest now. I'm looking at the skin integrity. So there's no port or pacemaker. His skin integrity is clean, dry, and intact. His color is appropriate for ethnicity. He has equal and symmetrical chest rise and fall. He's not using accessory muscles. His positioning, he is in a semi-Fowler's position, not in any distress. And his chest is proportional to his body shape. He doesn't have a barrel chest or that sort of thing. So now I'm going to palpate his chest for lumps. Are you tender?
No.
No tender, no lumps present in the chest. And now I'm going to auscultate heart sounds. And after that, I will auscultate lung sounds. So this is aortic at second intercostal space, right side. Pulmonic, second intercostal space, left side. Third point, third intercostal space, left side. Tricuspid, fourth intercostal space, left side. Then we have mitral, fifth intercostal space, left side. And now I am going to listen at the point of maximum impulse for 60 seconds. So S1 and S2 were present, and he had a regular rhythm. So now I'm going to ask you some questions. So do you have any shortness of breath?
No.
Okay, do you experience any back pain at all?
No.
Okay, do you have any concerns regarding your heart and your back?
No.
Okay, now I'm going to assess your lung sounds. If you can sit up for me, please. Okay. So now I'm going to listen to your lung sounds. Lung sounds were clear bilaterally on the anterior aspect. I'm going to listen to the posterior lung sounds. Breathe in. Breathe in. Breathe in. Breathe in. Lung sounds were clear on the posterior aspect. So do you smoke at all?
No, I don't.
Okay, not smoking is good. Smoking can cause COPD, so it's really good that you're not smoking. So have you had any difficulty breathing at all?
No.
No, okay. So now I am going to have you lay back down. And I'm going to do your abdominal assessment. So I'm going to look at his abdomen. His skin is clean, dry, and intact, no lesions. The contour of his abdomen, he doesn't have any visible deformities or anything. Protruding alpine, like no hernias. I'm now going to auscultate in the right lower quadrant first. So bowel sounds were active in all 4 quadrants. If they were hypoactive or absent, I would listen to up to 5 minutes in each quadrant. And I also touch my stethoscope to their skin, but since he's uncomfortable with that, I will compromise with him and listen over his shirt. So now I'm going to palpate. Let me know if you're tender.
Okay.
Are you tender?
Yeah.
Okay, now I'm going to palpate your bladder. Okay, was that tender?
No. Okay,
so his abdomen was not distended, his bladder was not distended based on palpation. So have you been having like a upset stomach recently?
No.
Do you have any concerns regarding your stomach?
No.
Okay, how have your bowel movements been looking?
Brown and some.
Okay. So now I'm going to do a GU assessment. I'm first going to ask you some questions. So, have you had any difficulty peeing, like any burning on your penis or anything like that? No? Okay. Do you have a rash down there?
No.
No? Okay. Well, now I'm going to look at your perineum. If you're uncomfortable, please let me know.
I will.
Okay. So when I'm looking at his perineum, I am looking for any signs of parasites, compromised skin integrity, a rash. So his skin looks clean, dry, and intact, and the color is appropriate for his skin color. There's no rash or parasites present, and no foul odor noted. I'm going to turn you now. 1, 2. So I'm looking at his coccyx, his lower back, his perineum, and his buttocks. There are no foul odors, no parasites. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. His perineum, there's no rash, no parasites, no foul odors. I'm going to put you back. So, I'm now going to do your lower extremities. So I'm going to inspect. You want to pull up your toes for me? Thank you. So I'm looking at skin integrity. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. There are no lesions present. Alright, you can go ahead and put that down. It's clean, dry, and intact. Color is appropriate for the ethnicity. Okay. Now I'm going to do my circulation. So I'm going to do pedal pulses. Okay, even 2+. Posterior tibial pulses are even in 2+. The skin temperature is warm and there is no edema present. So now I'm going to do your motor skills. So can you pull up? Push down. So yeah, it's equal bilateral strength. Now I'm going to have you wiggle your toes, and now kick your legs around like you're riding a bicycle. Okay, so yeah, it's fine and gross motor skills present, full range of motion with those. Now I'm going to do sensory, so you can close your eyes and tell me what toe I'm touching.
Big toes.
Okay, now I'm going to assess your edema. So your toenails, not your capillary refill, so your toenails are well maintained. Your capillary refill was less than 3 seconds. His toenails are not clubbed. Now I'm going to do this capillary refill. Okay. Capillary refill less than 3 seconds, and his toes are well maintained and not clubbed. His fingernails are also not clubbed. Not clubbed and well maintained. Okay, there's no swelling in his joints on his toes. And now I'm going to palpate. Let me know if you're tender. Are you tender?
Yeah.
Okay. No mass is present based on palpation. I'm going to palpate again. Okay. Are you tender?
No.
No, okay, and no mass is present based on palpation. Now I am going to ask you some questions. So have you had like any knee pain or joint pain?
No.
Okay. Do you use any assistive devices to walk?
No.
Okay. Have you had any problems or something that you'd like to tell me with your legs? Okay, so now I'm going to have you put on your shoes, your non-slip footwear. I'm going to assess you walking. So you're going to walk from all the way to that chair and then head back on the bed. Okay, how often do you walk a day?
Every day.
You walk every day, how long?
Oh, I don't know, 3 hours.
That's really good. I'm happy that you're doing that. Okay, so now you can go ahead and lay back down. If walking is really good for you, I'm going to assess your temperature again. Okay, his temperature is warm. Okay, do you have any concerns for me about your body?
No.
Okay. Well, your collar is within reach.
Thank
His
you.
gait was steady and independent. Bed in the lowest position. Bed is locked. this side, it's within reach. His calling is within reach. So now I am going to sanitize my hands. You let me know if you need anything, okay?
I will, thank you.
You're welcome. I am now going to document everything I did and my skills complete.